All right. Well, good evening, everyone. My name is Dr. Ted O'Connell. I am the Residency Program Director at the Kaiser Permanente Napa-Solano Family Medicine Residency Program and the Chief of Adult and Family Medicine at our Vallejo facility. It's my pleasure to be joining all of you. I just want to say at the outset that this is really intended for all of you to help get some of your questions answered and hopefully bring a little bit of clarity to what otherwise could be a time of uncertainty. So I want to make the majority of what we're going to do together this evening a Q&A. And so please make liberal use of the chat function. I'll be monitoring that and then we'll take the questions from there. And if you're comfortable with it, if you do have a question, what I'd like to do is ask you to go ahead and pose it so everybody hears it. As I see the questions come up, I'll call your name and ask you to just introduce yourself so that we get to know one another. So I just want to kick this off by saying a lot has changed in these last 18 months or so since the pandemic first started. And last year there was like a lot of uncertainty going into residency interview season about how things would look. And students also had rotations disrupted, medical school disrupted, lives disrupted. And I'm not minimizing anything of what's going on now. And at the same time, things are different. Fortunately, medical school rotations and residency rotations are in full swing. And to my knowledge, medical schools aren't keeping students out of rotations. So I think we're in a better place there. Last year, there was a lot of uncertainty from students about their letters of recommendation. And if they didn't have clinical rotations, where would they get those letters of recommendation? And sub-Is were being disrupted. And I think a lot of that has kind of sorted itself out. Yet at the same time, here we are looking at an interview season that's going to be at least partially virtual, if not mostly virtual. And so that's really what I want to focus on. This session is talking about interviewing in a virtual environment and how to kind of maximize that, how to represent yourself very well, how to evaluate a residency program, how to get a sense of the culture and the people of a residency program in that environment. And then, of course, whatever questions all of you have that you'd like me to answer. As we go into this, I think that you will find that many, if not most programs are going to be doing virtual interviews. There are some that still are looking at hybrid options or even a smaller subset that are looking at just in-person interviews. And that ends up kind of being an individual choice. Our residency program several months ago made a decision to do 100% virtual. And the plan at that time was to do 100% virtual with the opportunity to come on campus for tours and kind of second look situation. And we did it for a number of reasons. One is we were kind of looking down the road and seeing that this pandemic still had not really sorted itself out. The Delta variant was just getting started, and we had some concerns about that. And at the same time, we were also looking at it through an equity lens and realizing just how much it costs students, applicants, to go out in person and do interviews. And we thought that, last year it had its challenges, but it was also quite successful and decreased the debt burden that students carry. And so we saw some advantage there. We were also looking at the carbon footprint involved in interviewing in person. And then also just the impact on your rotations and your professional lives for having to go out and do in-person interviews. So for those reasons, we were leaning towards virtual. And then this Delta variant reared its head, and our organization institutionally made the decision to not allow in-person interviews just because of what was happening from an operation standpoint in our hospitals, and the need to cut down visitors and foot traffic and reduce risk of people getting in planes and traveling. And so we've decided to go all virtual. And as I said before, you will find that probably to be the majority of programs this year. with some programs that do hybrids. So with that, we're going to kind of begin this discussion really focusing on virtual interviews. And go ahead and drop in questions if you have any. But I just kind of want to give a kind of high level overview as we go into this and talk about what you might be able to do to kind of put your best foot forward, to decrease your anxieties, and to really be ready for interview season. So the first thing I would say is make sure that you are reasonably comfortable with the technology involved in virtual interviews. And this is a lot easier to say this year because now we've all spent a year plus doing Zoom and Teams and FaceTime and all kinds of other interactions in this video environment. When a year plus ago, all of that was relatively new. But that being said, that each program that you interview with is really going to potentially be using different technology. As I said, Zoom, Teams, a lot of programs are on this thing called Thalamus now that's kind of a interview season management system, but it allows for scheduling and it has a video platform built in. So you'll want to make sure that ahead of time, whatever that you're using, that you are at least reasonably comfortable with the technology so you don't have to worry about that piece. The next thing I would say is get familiar with some of the questions that are going to be posed to you through the interview season. And I put in the chat there, I put my website up. I have a blog on there that's really intended to magnify some of the discussions that I've had over the years. And my intention is to make the entire medical education process a bit easier on you. And so in there, I've compiled, I think, most of the questions that you may be asked in a residency interview. I'm not going to claim that list is comprehensive, but there's a really good list in there. And what I would recommend at a bare minimum is that you really read through that list and kind of contemplate how you would answer some of those questions. And then taking it a step further, if you have the time and energy, I would say, jot some notes down about how you might respond to each of those questions. And if you have somebody that you can practice with, I would say practice your answers to some of those and get some, do it with several different people if possible, and really try to get some good feedback about their thoughts on your answers to those questions. And then I would even take it one step further and say, do it through Zoom or through Teams or through some video platform so that you're really getting a sense of answering those in that environment, and ask whoever's working with you on these questions to give you real feedback about your body language and your energy and how you're coming through across through this video platform. As you're thinking about the technology, think about your environment as well. And that means making sure that during an actual interview day that you're going to be in a comfortable kind of clean space. Think about your background. Behind me, this is my office. I like music. I have records back there. I think that kind of speaks to my personality a little bit. Some people will want decide that you want something bland, and that's fine. Others will think about setting up a bookshelf with books that represent you or art or whatever. And I think all of that is fine. There's no real rules around what your background looks like, and it should really represent you and also whatever it is that makes you most comfortable. And at the same time, you want to be thinking about your lighting. You want to be thinking about any distractions that might come through. So that means silencing your phones and other devices that might go off. It can be endearing when pets come in and pop into your video. At the same time, you probably don't want that as a distraction. It can also be a conversation opener. So maybe if you're really daring, you'll have your cute cat pop in and use that as a jumping off point. But I think probably for most people, the fewer distractions, the better. I get asked questions about how do you dress. I would suggest dressing as you would for an actual interview. And that means, very professional attire, at least for the portions of whatever the interviewer can see. But we all have this tendency to think, oh, it's an informal environment, so informal is okay. Skew on the side of dress just like you would for a regular interview day. I mentioned body language earlier. Be aware of your body language and how you're coming across, and try to get some feedback about that in advance. Be yourself too. The whole interview process is a two-way street. It's you being interviewed and you interviewing a residency program. And you really want to get a sense of who they are, and you want them to have a real sense of who you are as a person, so that you can try in this, one of the hard things in this environment is to get a real sense of the people and the culture and what the environment is like. But the more they're really seeing who you are, the better everybody is able to assess, the fit. And at the same time, I want our applicants who are interviewing with us to get a sense of who I am and who our faculty and residents are, so that you really can try to find the best fits in terms of residency training. The last thing I'll say about kind of prepping for your interviews is really do your research in advance. And I emphasize this point, whether you're interviewing in person or whether you're interviewing in this virtual environment, is you want to have done your research about a residency program, so that when you're asking questions, you're kind of asking next level, next order questions, and not something that you could easily find on a residency program's website. Because if you do something like that, if you ask a simple question that's easily findable, they may assume that you're not that interested in the residency program, or that you haven't invested time in the process. So really getting, doing your research in advance of the interviews, so that you can go in and really get a better sense of the program and demonstrate your sincere interest. And one of the reasons I'm really emphasizing this is programs realized last year that it is more convenient for applicants to interview, and you can interview at more programs. And so these residency programs are having to sort through who's actually interested in my program and who's interviewing at 40 places, because you can now. And so by having done your research, you're able to demonstrate some sincere interest in the program. And then for those programs where you are really interested, you're getting to know the program better and asking deeper questions about their curriculum and their people and the opportunities and all of those things that go into an interview season. The other important reason to do research is you may be able to use it as an opportunity to make a real human connection with the people that are interviewing you and the people you interact with in these virtual environments. And so when you're scheduled for an interview, I would actually suggest that you reach out to the program coordinator and see if you can find out who you're going to be interviewing with, or you may even get that schedule in advance. And if you go to that residency program's website, oftentimes you can find out additional information about that person, whether they're the program director, faculty, resident, behavioral medicine staff, or otherwise. And if you're finding some things where you have some mutual interests or other human connections, it's an opportunity during that interview to bring that up, or use it to your advantage to connect with somebody and say, oh, we were both born in Paris, and I can't believe that, or we both have this area of research interest. That's how humans connect, and anything that you can use in an environment like this to make a better human connection, I think can only serve to your advantage. So that's kind of my high level overview on this whole thing. And I have plenty more to say about what to do during the interview, what to do after the interview, how to evaluate culture. But I want to really make sure that this session that we're doing here until 7 p.m. on the West Coast brings maximal value to all of you. So I'm going to stop talking for a moment and jump right into Q&A. And I think just for fairness, we'll just go in order. And if I'm seeing any themes as I start reading through the chat, I may group questions together. So let's see. Sarai, I'm going to hold your question if you don't mind. That one looks like it is very specific to my residency program, and I'm happy to answer that. The reason I'm going to put that one on hold is I know that not everyone on this session is necessarily going into family medicine, and that means you may not be interested in my residency program. So I want to make sure that that I'm answering questions that are valuable to the most number of people. If we have time at the end, I promise I will answer your question. If we don't have time, my residency program is going to have almost weekly Zoom sessions on all the various aspects of our curriculum, and you'll have lots of chance to interact with different faculty and residents and get a real good sense of all those things that you're asking in that question. So I hope you don't mind if I pass on that one. I'm going to hold on that one just for a moment, and I'm trying to talk and read at the same time. For those who joined after you sent the link, we can't see it in our chat. Could you please resend the link? I do not, I'm not sure, Patty, what link you're talking about other than the Zoom link. And I don't have access to everybody's emails in front of me, so I don't know that I can send that. Oh, it looks like maybe Shanaz has shared that information.
Yes, yeah, thank you so much, Dr. O'Connell. That's what I was asking. We couldn't see the link for your blog.
Oh, I'm sorry.
Yeah, so we got it now. Yep.
Okay, perfect. Yeah, make use of that. It's I've curated that list over the years. So thank you, Erica, Shanaz, everybody else who sent that. Okay, here's a question from Erica. If you don't mind, Erica, I'm going to ask you to pose this question so everybody knows what I'm answering.
Yeah, so my question was, a lot of programs since last year have been more active on social media, especially Instagram. And so I was wondering how important it is for applicants to have a strong social media or digital footprint.
That is a great question, Erica. I would say not important at all. And I almost would err on the other side and say, like, if you have a strong presence, programs that are really interested in that or have had long-standing social media presence and didn't just ramp up in the last year, they might be interested in it if you're, or doing something interesting in the social media realm, whether that's LinkedIn, Instagram, Twitter, Facebook, TikTok, whatever. But I think, it also cuts both ways, and programs could make judgments about you. They could interpret things the wrong way. They could hold different political views than you have. I think there's just all kinds of opportunity for misunderstanding or misinterpretation. And so I would not suggest that you downplay your social media presence if you have one, but I would also say don't worry about developing one, or don't think that it's important. In my mind, this is on the residency programs to have that presence. And really what they're trying to do is, in this environment, they are trying to give you a sense of who their people are, what they're all about, how they have fun together, how they bond, what the environment's like. And that's really what they're trying to get across. So I would put the onus on the residency programs to have the presence.
Awesome, thank you. That was really great to hear.
Yeah, my pleasure. Okay, Patty, do you want to propose your question? This is actually a great question.
Yes, I would love to. So first of all, thank you so much for the talk. Also, weekly Zoom meetings are amazing. Like, I'm shocked that there's a residency program out there doing that. So I will definitely be seeing you. But overall, so my fellow classmate is actually here too. Johanna and I went to the American Academy of Family Physician virtual conference last week, and we were in a bunch of social hours where people were asking what I always thought were red flag questions. What are your call schedules? What are your hours? What's the reimbursement? What's your salary? All these questions that I always thought were these red flag things you should never ask. So if you could kind of elaborate, what do you hear as a program director that makes you think like either this person isn't that serious, or like we don't want to consider them anymore? I think most of us know what we should be asking, but no one ever really talks about things that we should avoid mentioning. So if you could please elaborate on that.
Yeah, those questions that you just mentioned, they can really be interpreted different ways. And I would say you also want to think about who you're asking those questions to. For many of what you asked in terms of call schedule, curriculum, reimbursement, vacation time, like most of that information is readily available, either on the residency's website. There's also aggregate sites that are out there that we all submit information to that will give you very granular information to that. And so, I think the questions can be interpreted a lot of different ways. One is you're just wanting to really get a sense of what's my life going to be as a resident, right? I think why you're asking is, could it be a red flag? Is, am I sending the message that I wanted to have a lot of time off, or that I don't want to work too hard, or I'm worried about not about patient care, but about my free time? And so that's why you do want to really get that information that is embedded in those questions. You really want to be careful about how it's asked. And so one is, I would say, look on the websites and see what amount of that information you can gather without necessarily having to ask someone. And then you can also talk about kind of ask around the question. So you can ask a resident, so tell me what your call nights are like. And then that can naturally lead in. For one, it'll just be interesting to see how the resident answers that question, right? And give you a sense of like what's really going on at that residency program. And from there, you can say, you can ask about their backup system or their support for residents. You can ask about wellness programs that exist within the residency to get a sense of, are they really supporting, work-life balance is a difficult topic, but are they really trying to support resident wellness? And do they have structures and programs in place where a resident really does feel supported and engaged and doing meaningful work during their working hours, so that also helps prevent burnout, right? And if you're really doing work that you love and feeling that it has meaning. So I think there's a lot of ways to kind of answer those questions. I would also say, over time, you will find opportunities to develop relationships with different residents and different programs, whether that's through virtual happy hours, during the interviews, during sessions like this, if somebody gives you their contact information. And as you get to know a resident better, you can also kind of ask some of those questions in a little bit, I don't want to say safer environment, but an environment where you're more likely to get the real answer that you want, and without having to worry about what's embedded in those questions. So yeah, it's kind of, it's unfortunate that that's the way people feel about those questions, that they're red flags. But really when we ask those questions, we're really getting at, is this a healthy working environment? Is this an environment where people enjoy working with one another and feel adequately supported? When they're home, are they actually home and not carrying a beeper or about to be called into the hospital? Can they leave, can you turn your computer off at the end of your work shift and be home with your family? When you call a consultant, are they going to answer your question and teach you, or are they going to yell at you? All of those types of things are really what you're, I think, trying to find out with some of those questions. So I wouldn't want to call them red flags. In terms of don'ts that people ask on interview questions, one is things that are, as I said earlier, that are readily available on the residency website. If it's there on page 1, that's a don't, because that just means you haven't done your research and you're probably not that interested. And they may make all kinds of interpretations about that. Like, if they're not going to do the work to be ready for this interview, where else are they not going to do the work? So that kind of thing. You got to be careful about politics and things like that sometimes can creep in. So I would maybe put those in, it's like, what do you not do at a dinner party or a cocktail hour? Try to stay away from politics and religion and things like that. And I would say the same about interviews. Otherwise though, I'm trying to think of like real don'ts. You need to be careful about trying to compare and contrast specific programs, because nobody wants to, if you're trying to tout something about your program, it can be perceived as making a negative judgment about another program. So it's better to and programs aren't supposed to ask about where else you're interviewing. And so you just want to be careful about those questions, because that'll make people pause. So off the top of my head, that's where I would land on the don'ts. So thank you for the question, Patty.
Thank you so much. That was an awesome answer.
Absolutely, thanks. Christiana, I hope I'm pronouncing that correctly. Do you want to talk about evaluating culture?
Yeah, you said it perfectly. Yeah, I would love to hear more about that.
Okay, so the question is, how do you evaluate culture in a virtual interview environment, right? This is probably the toughest thing about interviewing virtually. And I think the thing that gives applicants the most angst, and that's largely because besides geography and curriculum, kind of the fit and the feel of a program is a lot about how people make decisions. Everybody talks about gut instinct and what that means. And a lot of the decision making is based on that. It's based on, can I see myself thriving in this environment? Is this a group of people that I want to be on call with at midnight? Is this a supportive atmosphere? What do these people like to do in their free time? Or am I going to feel like a part of a family for the next 3, 4, 5, 6 years, depending what type of residency you're going to? I will also tell you that this is the question. Sorry, phone's ringing. This is the same question that gives programs the most angst, because they want to be able to adequately represent their culture and their people and the things that make them special. And we all know that that's very hard to do in this virtual environment. And I think that's why you've seen programs try to step up their social media presence. It's about trying to represent that culture. It's just really challenging, and it can still be done. I'm not going to say is being on Zoom or Thalamus or Teams the same as being able to be there and go on a tour and meet a whole bunch of people and see how the residents interact with nursing staff and see how the residents interact with the faculty and sit down and have lunch with everybody and really get a sense of the vibe. Like a lot of that is missing. But things you can do to get a sense of the culture. One is social media is a way to get a sense of what's going on and how a program's trying to represent themselves. Two is during the interview process, ask some of those questions of people, especially of residents. Ask them what things about, like, what happens around bonding, and what does the program do to support resident wellness, and what do the residents like to do together in their free time, and just kind of peel the onion back and get a sense of what that's all about. I would definitely recommend that any type of virtual happy hours or other opportunities to engage with residents, that you try to take up those opportunities. Again, you're going to be interviewing at quite a number of places, so at some point you'll have to kind of narrow down the ones that are of interest to you, so you spend more time engaging and trying to figure out the culture of those programs. I would suggest trying to get contact information for a number of residents at the programs that you're really interested in. I will say, residents are already busy, and if you get put in touch with somebody and they don't get back to you, I don't know that I would interpret that as a negative just because of how busy they are. But the more that you can engage with them, the more sense of what they're all about, and more different perspectives you'll get, and even more idea about who you may be working with next year. So that's a really good way to figure that out. If you can, again, every program is going to be different, but if there is an opportunity, and I don't want to say book a flight just to go have a tour or see a facility or interact with a few people, but if you are going to be in the area, really think about trying, and the opportunity exists, because again, we don't know what's going to happen over these next few months with Delta, or who knows what the next variant is that may be coming through. So I don't want to try to predict the future, but if there is an opportunity to meet in person and do something sociable, that's a real good way to get a sense of culture. Towards the end of interview season, you can try to also interview, or not interview, but interact with some of the key faculty who perhaps have an area of curricular interest that aligns with yours. You may want to touch base with the program director towards the end of the interview season, either to express your interest or to ask a few questions that'll really help you tease out some of those culture and fit things that you've kind of been trying to figure out. But I would say the more kind of different data points or touch points with the programs, and especially putting your energy towards those programs that are of interest to you, to really put your energy into some of those. And I think you'll get a pretty darn good sense of culture. We did this all virtually last year. And when our new residents showed up on campus in mid-June for orientation, it felt like they had been around for a while, because a lot of them had been on our Zoom sessions and other, things that we were doing to engage. And I feel like they got a really good sense of culture, and we're not surprised by anything. So when done well, I think you can get a pretty good sense of what's going on.
That's really encouraging. Thank you.
Sure. Is it 2? I want to make sure I'm pronouncing this correctly. Asking about letters of recommendation.
Yeah, you can say it too. Hi, my name is Tu. I'm 4 years med student, and I'm wondering if you can tell more about the importance of having like at least 2 family medicine letter of rec as compared to like 4 different specialties, just because our school family medicine rotation got cut short during our 3rd year because of COVID. So I'm just that's my question.
Yeah, that's a really good question. And I want to make clear, I'm answering this question for family medicine and not for other specialties, because every specialty is a little bit unique in terms of what they're looking for in letters of recommendation. If you're applying to surgery, they're going to probably want all of those from surgeons. In family medicine, I think we all understand that this last year and a half has been a really unique and disruptive time, and that your experiences have been affected by the pandemic, and that you may not be able to get all of the letters from exactly the certain specialties that you want. And I think there's just that tacit acknowledgement that that's the case. So I think if you had 1 from family medicine and 3 from other specialties, that's absolutely fine. If you have 2 from family medicine, probably a little bit better. But again, I don't know that anybody's really going to make any judgments about that in this environment. What I would say is, as any program is evaluating your application, one of the things they want to do is make sure that you're truly interested in their specialty, that your interests are really aligned with that specialty, that you're going to remain with the residency program until graduation, that you're not applying to dual specialties, because then you may be using one or the other as a backup, or you may not be as interested as they want you to be. And so if you're in a situation where you have 4 letters of recommendation, 1 is from family medicine and the other 3 are from surgery, I'm going to read that as this person may be applying to surgery and family medicine's a backup. So you have to be careful about that. If they're spread across different specialties, then we'll get that loud and clear. And we're also always looking at, and I want to be real clear too, it's easier in this virtual environment to apply to more than 1 specialty and interview at a whole bunch of specialties, or at multiple specialties. And so programs are even more on the lookout for this kind of thing. And they'll look into the application for other signs of, what are you actually interested in? And so if you have multiple letters from a different specialty, and you also did research in that other specialty, guess what we're thinking is you're probably more interested in that other specialty. And so you really want your application to make sense and to be consistent, or to speak to it in your personal statement. Suppose you were doing heavy duty dermatology research and you made a decision that you wanted to do a different specialty, then that should be reflected somewhere in there so that nobody has to wonder about it. And you can speak to it, that I went into medical school thinking I wanted to be a dermatologist, but then I had my rotation in this other specialty, and it all came together for me. And I decided that I actually wanted to make a change and really just be able to speak clearly to that. So I know that's a little bit of a long-winded answer to your question, but I do not think it matters to where your letters are coming from nearly as much as the content of the letter, how well those people know you, what they're saying about you, their experience as letter writers, and then the overall consistency of your application.
Thank you.
All right, there's a question, I'll read this one. How can we sign up for the weekly Zooms with Kaiser Napa-Solano? So I'm still in the process of organizing. I kind of did an early lead in on mine because I heard there was a session at the AAFP conference on virtual interviewing and that it was really popular and there were a lot of really good questions and there's a lot of anxiety around it. So I said, well, let's start to ease people's anxiety early. And so I scheduled mine well ahead, which is today. We will probably be starting the rest of them in early to mid-September. And I would say just keep an eye on our social media is probably the best way. You can also, I'm going to type right here. The name of one of our coordinators. If you email him and let him know you'd like to be on the mailing list, we will just get you the entire schedule. But I'm hoping within the next 2 weeks or so, we'll have the whole schedule published. And it covers all kinds of different curricular elements of what we're doing. We're going to engage residents and faculty in these sessions, so you really get a good sense of different people. And we're going to do enough of them so that if you want to, really get a good sense of what we're all about, you'll be able to. So thank you for asking that question, Sarah. Emma, do you want to ask your question?
Sure. I'm Emma. I'm from Kansas City. And my question was about when you're in the interview process and talking about possible fellowships or like interests that you're really devoted to. Like, for example, I'm really interested in women's health and asking toward either residents or the program director more about that specialty. Does that, I guess, put more weight in your application that you're looking already a step further with the fellowships that they potentially have?
That's actually a really good question. I don't know that it would necessarily put more, I don't know that they would give you any more credit or any more like attention because you're interested in a fellowship that they have. And I would say that for a couple of reasons. One is their applicant pool is likely to be fairly broad for their fellowship. Two is the residency program director is going to be a different person than the fellowship director in most cases. And so that residency director may not have as much of a vested interest in creating that alignment. Three is we know people do change their mind over time. And so investing in somebody, significantly because they have an interest in your fellowship, I think is a little bit short-sighted, and it's probably more important to be finding the people who are the right fit for your residency. And so it's kind of nice to know that you might be interested in that fellowship, but I think most programs probably wouldn't put that much weight on it. I would say that you as an applicant, there's a lot of applicants out there that for certain specialties may try to align themselves with a program that has the fellowship that they want, because that may increase your chances of getting into that fellowship. It may also diminish your chances too. It's just like med school applications that just, one wrong encounter with the wrong person sometimes can derail things. So, it goes both ways. The other thing that I would say is, thinking if you express a real heavy interest, and I'm going to use you as an example, Emma. If a residency program is getting the sense that you are super psyched about women's health, and you don't talk enough about your interest in the other parts of family medicine, you may get their wheels turning and saying, like, is this person going to adequately engage in their pediatrics rotation and their inpatient medicine rotation and their emergency medicine rotation? Or are they really, going to not engage as much in those and be too focused on women's health? So I would just say, express your interest in women's health and that you think you want to pursue a fellowship, and in the same breath, make it clear that you really are interested in the breadth of family medicine, and make it clear to them that you really do, you do want to be really engaged and learn from all these other rotations, so that they don't worry about that. And then you also want to make it clear to them, like, are you interested in OBGYN, or are you interested in family medicine? And so by speaking to that, you just put all those fears to rest, that you're not double applying, but that you're actually really interested in family medicine and think you may want to do a women's health fellowship of some type, whether it's OB or otherwise.
Thanks so much.
Of course. Okay. Gabriella, do you want to ask the question about personal statements?
Yes. Hi, my name is Gabriella and I'm from Chicago. And I'd like to know more about personal statements, what you like seeing in them, or what stands out to you when you're reading them.
That is a great question. I'm really, make it clear, I'm speaking for myself. I think different people read personal statements a little bit differently. When I'm looking at it, I'm trying to get a sense of who this person is and what they're all about and what's meaningful to them and what's their purpose in pursuing this type of training. And I'm also sometimes just trying to pick out things that are unique about them. And that may be from their personal statement, or there's one line, it's a really tiny little area in the ERAS application that lets you talk about your hobbies and interests. And you get all this space to talk about everything else, but this tiny space for hobby. I zero in on the hobbies and interests. Not to say I read it's very holistic review, but I think that's an opportunity to really get to know somebody as a person and to make that the interview a comfortable process for them, where they're really getting to talk about themselves and their interests outside of medicine, and their why within medicine. Why are you passionate about this, and why this specialty? And by talking about that, I think it makes a better connection. I get to know more about you as an individual and as an applicant. I get a sense of, like, is our training program and what we have to offer the best fit for you, or should I be trying to steer you to a program that may be a better fit? In my specialty, I think it's a pretty altruistic group, and we really want, at the end of the day, what's best for our specialty. And we know that I'm only going to match 6 people in each year out of 1,000 applicants. And if your training desires and career goals are much better aligned with another program that I know about, why wouldn't I put you in touch with them? It's going to make you happier. It's going to make the program happier. It's going to make for a better family physician that's going to go serve whichever community you decide to serve. And so I'm really just trying to get a sense of what you're all about. That being said, I don't think you need to, everybody stresses about their personal statements. There's every year there's like 5% of them that are really not good, and 5% that are amazing and should be in the Smithsonian or something so everybody can read them. And all the others are they're nice, and it's a nice chance to get to read about people and what they want and their life experience. And I think you should view it through that lens, as you're really just trying to represent yourself to a residency program. And the more you can be yourself, the more you're going to find the right fit for you. And so that, I think I'm answering this by saying be yourself, and there's not really anything specific. I'm suspicious there's something out there where everybody's being told to kind of give an introduction about what brought you to medicine, give a patient experience, and then come up, and how that affected you, and then talk about something else. I would say if you can get away from the formula a little bit too, it may make you stand out. And I don't know where this formula came from, but it's very definitely taught to almost every applicant. So what I'm saying is be yourself. Don't try to be crazy unique unless that's who you are. And then use that as a jumping off point to get to really into the interview day, where then you can expand on some of what you've brought up in that personal statement.
Great, thank you.
Absolutely. Okay, Alyssa, do you want to ask about post-interview etiquette?
Yeah, so thank you so much for hosting this. This has been really informational so far. So my question is, obviously, as we're going into virtual interviews, post-interview etiquette has probably changed a bit. So I was just wondering, as we go into this, what is sort of considered appropriate and maybe not? Is it appropriate to ask for emails of people that interviewed you, to send an email thank you? Just sort of how we should go about navigating this.
Yeah, that's a great question, Alyssa. So is it Alyssa or Elisa? I'm sorry.
Alyssa.
Alyssa.
Yeah.
So I want to even give like the prequel to this answer. And that is, during your interviews, I would suggest that you jot down the name of everybody that you're spending significant time with, and take a few notes as you go. You don't want to be furiously scribbling while you're trying to talk, but as you're having that conversation, a few key words that will remind you of what you talked about. And then asking for emails is absolutely fine. Probably the easiest and most direct way is, for one, those emails might be on their website. Two is the residency coordinator may provide those for you without you having to ask. And then I would also say you can ask the residency coordinator for the emails of X, Y, and Z individuals, so that you don't have to ask each of them. But if you have any concern, of course you can ask, and I don't think anybody would not want to give it to you. The second part of my question or my answer is, try to do your emails or your thank you notes fairly soon after your interview day. And I say that for a couple of reasons. One is your thoughts will be freshest, and you'll also be carrying a little bit of kind of the gut or the vibe about the program into your letters. It'll also make you look like you're really on top of things if you're sending that out or mailing it out, or however you decide to do it, in a pretty timely fashion. And programs want people who are on top of things. That it just is one more indicator that you may be on top of things as a resident. And then you'll have those notes where, if you talked about the sunsets in Maui, you can drop that into that note, so that the person who interviewed you go, oh, this person remembered what we talked about, or that was, oh yeah, that was a meaningful conversation. It'll make you stick in their mind a little bit more and help build that personal connection in this otherwise challenging environment. In terms of the etiquette around how you write this, my opinion, and I think it stands for most people these days, is it's 2021, and you can send a thank you note however you want, whether it's an email or a virtual greeting card or a nice piece of stationery. A nice piece of stationery has a personal touch. It's handwritten. There's still something kind of elegant about it. And at the same time, the post office might lose it. You can't always say as much in a handwritten note, just because of it's a little more challenging to write it out, and you may have limited space. You may be able to, with an email, be more specific about what you're saying and expand upon an idea. So, but I think at the end of the day, unless somebody's a dinosaur, I just don't think it matters, and that you should view them all being pretty equally. And just like I said about the personal statement, I think the content of what you're putting in there is the most important. One tip that I have for all of you, though, is really, when you're writing a thank you note, you should make it pretty personalized to the individual that you're writing to, and don't fall into the trap of kind of cutting and pasting the same thank you note with different people's names at the top. Because a couple of things happen. Sometimes the font shows up different and people can tell that you did that. And it just looks like it'll appear like you haven't put the effort in, or you don't have that much interest in the program, or you're just going through the motions. A lot of programs too, we all kind of want to know, like, who's interested in our program, or what kind of feedback are we getting, and so those emails will sometimes be shared to say, oh, hey, I got this email from Melissa, and another person will say, oh, so did I. And then if you get it and it's the same email, you can draw your conclusions that, oh, you cut and paste and you're not that interested. Whereas if I get one that talks about the conversation that we had and why you're interested in the piece of curriculum that I oversee, and somebody else gets a different one where you talk about what you talked, where you mentioned what you talked about with that person and their piece of curriculum, it kind of speaks volumes about your level of interest and how much effort you're putting into that particular program.
That's great. Thank you so much.
Absolutely. Willa, do you want to propose your question?
Sure. Hi, I'm Willa. I'm a fourth year at UNC in North Carolina. I was curious or interested in how US program or residency program directors evaluate and figure out, I guess, the vibes of your applicants through the interview process. What kinds of questions are particularly meaningful that you tend to ask, or do you get feedback from the residents during the little meet and greets, things like that?
So I'm going to try to answer your question maybe backwards, or start at the end of what you asked. So do we get feedback from the residents about meet and greets? I try to be careful about that, because if you're doing a virtual happy hour environment, I really want you to be able to talk to our residents and get to know them as individuals and ask the questions that you want to ask and get a sense of the culture and the people in the place without having to worry too much about what you're asking. That being said, you're on stage from if you were even coming to campus, from the time you meet the parking attendant to everybody you check in with and pass along the way, you never know who's going to pass along a positive or a negative word about you. And so when you're speaking with the residents and things like that, will they pass it along? Yeah. And more often what you're going to hear is the people who say, hey, we met, Willa was at our virtual happy hour. We loved her. She engaged with us. She seemed, her interests are aligned with our programs. She's easy to communicate with. I think she'd be a great resident. And every once in a while you get somebody who just clearly doesn't click with the group, or did something socially inappropriate or awkward. We'll hear about those, but I really try not to ask the residents about what's going on at those virtual happy hours. And we should probably not call them virtual happy hours either. Maybe I'll come up with another name for that. In terms of the interview process and what we're trying to assess, and again, I'm only going to speak for my program because you'll probably get different answers from different program directors about this. Really what we're trying to get at is a couple of things. One is, broadly speaking, does this person have the interpersonal and communication skills and likely bedside manner and empathetic nature and humanistic skills that you would want in your own family physician? Getting a little deeper, I would say, does this person truly want to be a family physician? Are they interested in being a great clinician? Are they interested in really caring for people? And then getting deeper still is what are we looking for? At the end of the day, it does come down to fit. And we want you to be thrilled with your training and to be totally engaged with it. And so we're trying to assess are your interests and values aligned with the philosophy, the core competencies, and the mission of our residency program. And there's a reason why we put our mission statement front and center, and why we talk so much about outstanding full spectrum family medicine, social justice, global health, community medicine. Those are the things that we're about. And so Do you have to love every component of our curriculum? No, but is it helpful if your interests are aligned with what we're about? It does. And that's, we want that fit to be right. And we want the training that we're providing to be what you're looking for. So that's really what we're trying to get a sense of during that interview process.
Cool, thank you.
Absolutely. Okay, Mark, do you want to pose your question? Then Willie, you may be up again, although we're running up against time. So maybe we'll take these two as probably our last questions, everybody.
Great, thank you, Dr. O'Connell. My name is Mark. I'm in Pasadena, California. And I just had a question as far as people who are earlier on in their medical education, MS2 and early MS3 students who are interested in a particular program. Would you recommend that they engage with that program faculty at all, or residents early on, or wait until closer to residency applications?
The answer is yes. Or where are you in Pasadena?
I'm actually at the KP School of Medicine.
Oh, cool. Awesome. I was engaged with them from the beginning. I think you're the first one that I've actually met that's at that school. So yes, I would say engage early. The more, it gives you a better chance to evaluate what they're up to. It gives you a chance to really get to know the faculty and residents. It gives them a chance to develop a long-standing relationship with you. And, as long as all those interactions are good and your involvement's great, like I do think it gives you some advantage in the interview process. And probably the biggest advantage is it really lets you know more about what that program's about. And it gives you a better chance to assess whether that's a place that you want to be. And so if you have a chance to get to know some of the faculty or some of the residents, that's great. If you have a chance to get involved in some type of volunteer project, again, I want to acknowledge some of this is really the community medicine volunteer projects, research. It's more challenging during this pandemic. So I don't want anybody getting nervous if you're not able to do this. But if there's an opportunity to get involved with something that program's doing, and then make sure you really do a good job with it and remain engaged throughout the process, that program's going to know you, and word will get around about who you are. And you never know, you may end up getting invited to a conference to present the work that you did, and then you get more chance to evaluate them. So I would say, yes, do try to do that. And that's a challenging thing to do because you're potentially engaging with the program early on. And you don't want to put all your eggs in one basket or spend too much time and find out that, or to the detriment of not getting to know other programs. But again, it's as a strategy, if there's a program that you think you're interested in, I would say yes, and you'll still have time to go do a sub-I or an audition rotation or an elective at other places and get a good chance to also have a little bit more engagement elsewhere. Or you do it, if you're really loving that program, then you go try to do a rotation with them. So I would say, yes, that's almost never a bad approach.
That was super helpful. Thank you so much.
Sure, absolutely. Willa, do you want to ask? Oh, this is a good question too. Go ahead and pose that.
Yeah, so I guess I saw or perhaps heard anecdotally that this past year with virtual interviews, there were a lot of people who kind of stayed in their region during the match. And I wonder, is that true? Do West Coast residencies tend to favor applicants from the West Coast or specifically their state? And if so, how does someone from outside of that region kind of show their interest?
Yeah, great question. And it's kind of a nuanced one where there's kind of layers to the answer. And one is that last year during the pandemic, medical schools restricted where students could go rotate and do their sub-Is. And that invariably led to, if you're at UCLA, you basically could only rotate at UCLA or very close sites. And so I think that created a situation where then those programs got to know those students, and there's a higher likelihood that they would stick around and go to those programs. And there were likewise programs that were not university affiliated that felt like they didn't have a chance to see applicants like the university systems did. And we had to we weren't able to host our sub-Is last year and did a virtual one to try to compensate for that. But I think that just the nature of the pandemic kind of created some bias. My second answer is that if you're talking about West Coast programs and California in particular, there are a lot of people in California and a lot of students who go out of state for medical school and then would like to come back to California for residency to be closer to home. And then they do. And then it kind of creates this look like West Coast programs only match West Coast people, when it's actually a lot of people choosing geography and wanting to come back home. And so that creates some of it. Some of it is related to where you do your rotations. You know, chances are you're probably selecting sub-Is at programs that you're more interested in. And so that influences where people go. And then if programs get to know you because you rotated with them and they really thought your performance was great, they just had a month-long interview process with you, right? And assessed how you're really likely to be as a resident. And that's going to influence probably the likelihood of where you're going to match. So there's a lot to that. But no, I would say that it's not the case that there's any type of bias or intentional bias in the system, or West Coast programs trying to match West Coast people. It's just, and likewise, South, East, you name the area. I think there's just so many factors that go into that. And I'll tell you, in our first year of our program, 5 of our 6 that we matched with were from the West Coast. And internally we said, uh-oh, like we got great people, but everybody's going to think we only match West Coast people. And so the next year we very intentionally recruited, like worked it to make sure that we were being very broad and matched Florida and Georgia and DC, I think DC, like all over the place. And I think that helped. And then we could honestly say to people, we're recruiting nationally. And really, if you're thinking about from a residency standpoint, you want to be recruiting nationally. You want to get the people who are the best applicants and the best fit, and and you do that by going nationally.
All right, thank you.
Yes, so I'm gonna. There's actually, Chris has a really good question. So I don't want to. If anybody needs to bounce off of this, no, don't worry. I'm not looking to see who's leaving. Feel free to do so. I'm going to answer Chris's question because I think this is a really good one as well.
So hi, my name is Chris. I'm currently in Philadelphia. So my question was for programs who are hosting in-person mixers, open houses, tours, will that have any impact on those applicants who aren't able to make it versus those who can?
Yeah, that's an outstanding question, Chris. And I think my answer to that is it depends on how intentional the residency program is being about trying to eliminate bias in the process. And it's just kind of natural that if somebody's close by and can have contact with a residency program, that program's going to know them a little bit better. And I don't think you're going to eliminate that. And is that type of bias okay? It may be. I don't know. I think the programs that are really thinking about this, what we're trying to eliminate, what we're trying to do is maximize equity and get away from any bias related to finances and support and things like that. And there's actually been a lot of conversation among program directors. I'm part of the Association of Family Medicine Residency Directors. We're talking about it. There's a collaborative of all the UC San Francisco affiliated program directors. We're talking about it. And what we're really trying to do is avoid bias that allows somebody who has a better financial situation could go fly to a program or to an area and go visit programs when another student may not. And I think when we're talking about being intentional about it, it's those situations that we're trying to minimize. And we're even talking about it to the level of, if you do have a situation where you're allowing, second looks or in-person tours or something like that, are you going to make a statement saying that this won't influence, the match process? Are you trying to set up a situation where those who are giving the tours or assisting with the second looks are not part of the selection or ranking committee? Like, are you really trying, you may never completely eliminate that. But there's a lot of conversation going on around it. I don't really know what the answer to your question is, because I think you're going to see every possible different permutation in response to that. But I think it's important to try to look at what the program is doing to try to be equitable, to try to minimize that bias, to try to support students as much as we possibly can, and then make your own determinations about what's right, because this is all new for all of us, and we're just trying to figure it out as we go along. But I think it's more, I think a lot of it's about the spirit of it. So I wish I had like a more definitive answer for you, but I don't know that there's a ton of clarity on that.
Oh, it's all good. Thank you.
Absolutely. All right, everybody, I'm a few minutes over, so I am going to wrap us up. But first, I want to thank all of you for taking the time to be part of this session and for posing such great questions. I think the questions that you posed really brought a lot of value for your fellow audience members, just to be thinking about some of these things and considering them. I put up my contact information at the top of the chat. So if any of you would like to reach out, happy to try to help you along in this process. As I said, we're going to be doing as a program, I'm here to help all of you. And I know this is not just a family medicine audience. There will be some other sessions that might be useful. I may even do something similar to this down the road. But hopefully for those of you interested in family medicine, you'll take part in some of the Zoom sessions and get to know our residency program a little bit better. But again, we're all about like the future of medicine and turning out great physicians for our communities. And for me, it's about turning out great family physicians. But I care just as much. I just got my cast on today. I care just about as having great orthopedists in the community so they can heal just like we do. So if there's anything that we can do or that I can do to help support you in this process, feel free. If I get inundated with emails, it may take me a little while to get back to you, but I will try to do whatever I can to help you in this process. And I hope you found this discussion to be valuable. All right, so with that, I'm gonna take us off record.